Okay, so then we'll talk about the other few other endocrine glands and their hormones. So those are the parts of my talk here. First, endocrine system. You know that two types of glands are present in our body: endocrine glands and exocrine glands. So we have endocrine and we also have exocrine glands. Okay. I will just mention few important differences between endocrine and exocrine glands. Endocrine glands are called ductless glands. Exocrine glands have ducts. So what are the ducts? Ducts are tube-like structures. So if you see an exocrine gland, inside the exocrine gland you will see duct or tube-like structure. Okay, this is exocrine. They have ducts. This is the duct, tube-like structure. Okay. In case of endocrine, there is no duct inside, so no duct is present. That is number one. Number two, endocrine glands release the hormones, into the blood. Okay, so inside the gland, of course, you have capillaries, right? Blood capillaries everywhere, and the endocrine cells will release the hormone into the blood of the capillary. So the hormone will enter into the blood from the endocrine glands. In case of exocrine, the hormones will be released into the ducts, not into the blood. So these are the cells of your exocrine gland, and they will release the hormone into the duct, okay, not into the blood. So that is another difference. Number three, once the hormones will enter into the blood, you know that blood circulates everywhere, right, in your body. So once the hormone from the endocrine gland will enter into the blood, then blood will take the hormone everywhere in the body. That means the hormone action could be generalized. Generalized means it can work anywhere in the body because blood is carrying it. So blood will circulate everywhere in the body. That's why we say generalized action. It is distributed everywhere in the body. So it may work in different locations. But in case of exocrine, you see that the hormones are released into the ducts, and ducts are tubes. So the tubes do what? Just come out from the gland and release the hormone here. So the action is localized. Localized action. Just localized means where? Just outside of the gland, because the tube ends just outside of the gland and release the hormone there. So the action of hormone is localized just outside of the gland. Now you tell me in which case the action could be far away from the gland. This one or this one? Endocrine. Because if the hormone is released from the pituitary, it can go to the toes, from the head to the toe, because blood is carrying it. So the action could be far from the site of production. So can act far from the gland. In this case, just outside of the, or we can say near the gland. Okay. So just remember those few differences between your endocrine and exocrine gland, and these differences means important properties of endocrine system or glands. So if I ask you, tell me few important properties of endocrine glands, these are also important properties of the endocrine glands, okay, or system. Okay, now we'll see the endocrine glands. Since we are talking about the endocrine system, we won't talk about the exocrine glands. We will talk about the endocrine glands. Important endocrine glands in our body are pituitary glands, pineal glands. Pituitary gland is only one, so pituitary gland, pineal glands, thyroid, parathyroid, then the pancreas. Pancreas is a mixed type gland, and inside the pancreas, remember if I ask you, is pancreas an endocrine? It is not purely endocrine, it is a mixed type gland. And that means what? The pancreas has both endocrine and exocrine parts. So pancreas is a mixed type gland. Why? Because it has both endocrine and exocrine parts. The endocrine part of the pancreas is called pancreatic islets. Okay? So pancreatic islets are also endocrine part of the pancreas gland, and then on the upper pole of your kidneys, that means on the kidneys you have glands like the crown of the kidney. If this is the kidney, just sitting on the upper pole of the kidneys, those glands are called adrenal glands, just sitting on the kidneys. Adrenal glands are also called suprarenal glands, another name of adrenal glands. Supra means above, renal is the kidney. So suprarenal is above the kidney. Very important glands. So we have two adrenal glands because we have two kidneys. Then the gonads. Gonads are also the part of reproductive system. So gonads are the parts of endocrine as well as reproductive systems. Male gonads are testes and female gonads are ovaries. Okay. So how many testes the male has? 2. Okay. How many ovaries the female has? 2. Okay. So 2 testes are the parts of male gonads and 2 ovaries are the parts of female gonads. Okay. So those are the gonads. You have any question? Yeah, inside the pancreas, the islets are the endocrine parts. Okay, now where they are located, your pituitary and pineal, those 2 glands are located in the brain. You know that. Those 2 glands are located in the brain. Thyroid gland is located in the lower part of the neck. And in the thyroid gland, probably I have talked about this before, but just again, thyroid gland has two lobes connected by a tissue mass. Two lobes are called lateral lobes. Okay? So this is one lateral lobe, this is another lateral lobe. One is here, another is this side. And those two lobes are connected by this tissue mass. This is called isthmus. Okay? The two lateral lobes are connected by an isthmus. That's the thyroid gland located in the lower part of the neck. Then, in the back of the thyroid lobes, you have 4 to 8 tiny glands. The number is not fixed, it could be different person to person. 4 to 8 small round glands are attached to the back of the thyroid lobes, not in the front. And those are called parathyroid glands. Okay? 4 to 8 in number. Then, inside the pancreas, the endocrine part is called the pancreatic islets, and then adrenal gland and gonads. So you see those glands in this picture. Now, as I have mentioned that in your brain, you have the pituitary gland, that is called the master gland. And pituitary has a boss too, that's the hypothalamus. So hypothalamus and pituitary are very closely connected to each other. Hypothalamus controls the pituitary, so hypothalamus is just above the pituitary gland, like this. If this is your hypothalamus here, hypothalamus, and your pituitary gland is here. Okay, so this is the pituitary. And hypothalamus is just above the pituitary gland and controls the pituitary gland. Now, the pituitary gland has two parts, as I have mentioned before. The anterior pituitary and posterior pituitary. Okay? And those two parts are connected to the hypothalamus differently. They are connected to the hypothalamus differently. How? The anterior pituitary is connected to the hypothalamus by portal system. What is the portal system? Portal system in your body is like this. You have one capillary bed here, capillary bed, and another capillary bed here. So anywhere in your body, if you see two capillary beds are connected by a blood vessel, that is called portal system. Not only in this case, anywhere in the body. If two capillary beds are connected, yes.
Can you write that on the board?
Two capillary beds. This is one capillary bed. Capillary bed. And this is what? Another capillary bed. So if you see two capillary beds are connected by a blood vessel, that is the portal system. So in your hypothalamus and pituitary, you have capillary beds and they are connected, anterior pituitary, they are connected by a blood vessel. And this is called hypothalamo, let's see, hypothalamic portal system, didn't mention here. Just know that hypothalamo hypophyseal portal system. So this is the portal system that connects the hypothalamus to hypophysis. Hypophysis is the pituitary, remember? Hypophysis is another name of the pituitary gland. So this portal system connects the hypothalamus and anterior pituitary. And hypothalamus talks to the posterior pituitary not by the portal system but by the nerve fibers. And this is a tract, that means bundle of nerve fibers, and this is called hypophyseal tract. Okay, tract is the bundle of nerve fibers. So, bundle of nerve fibers that connect the hypothalamus and posterior pituitary, remember that, that's the tract. Okay, so that's how the hypothalamus is connected to the anterior and posterior pituitary. If I ask you that the portal system connects which to hypothalamus and anterior pituitary, and the tract, bundle of nerve fibers, connect which to hypothalamus and the posterior pituitary. So you see the hypothalamus talks to two parts of pituitary differently, one by the blood vessels and another by the nerve fibers. Okay. Another thing you need to know, anterior pituitary is also called adenohypophysis. P-H-Y-S-I-S. Hypophysis, always remember, hypophysis is the pituitary gland. You remember the hypophyseal fossa on the sphenoid bone. That was the fossa for the pituitary gland. So hypophysis is the pituitary. Adenohypophysis is another name of anterior pituitary. Just remember it starts with A. Anterior pituitary is adenohypophysis. And posterior pituitary has another name that is called neurohypophysis. Neurohypophysis. Okay. So adenohypophysis is the anterior pituitary, neurohypophysis is the posterior pituitary. So that's how the hypothalamus talks to the pituitary gland. Now, as I have mentioned, a number of hormones are released by the pituitary gland. What are the anterior pituitary hormones? What are the posterior pituitary hormones? You need to know. Anterior pituitary releases 6 hormones. What are those? Growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone, and prolactin. Okay, so those are the 6 hormones. Try to remember those names. If I ask you which are the anterior pituitary hormones, those 6 are the anterior pituitary hormones. Okay, and then posterior pituitary releases only 2 hormones. One is called oxytocin and the other is called antidiuretic hormone, or ADH. ADH or antidiuretic hormone. So those 2 are posterior pituitary hormone. I will ask this, okay? So try to remember. Now, growth hormone, if you just think the name, what's the function of growth hormone?
Make you grow.
Yeah. Helps in the growth of the body. And growth hormone is released more during childhood and puberty. You know that body grows during that time. And growth hormone works on all tissues of the body. So growth hormone works on all tissues of the body, but on 2 structures the action of growth hormone is more. So first thing, growth hormone works everywhere, number one. But on two structures, the action of growth hormone is prominent more. Which two structures? The skeletal muscles and the bones. So growth hormone works more on the skeletal muscles and the bones. Those are very sensitive to growth hormone. And that's why the growth hormone helps in the growth of the body, because we know that the growth of the bones and the growth of the skeletal muscles are important for the growth of the body. Okay, so that's the main information about growth hormone. Now, normal amount of growth hormone secretion is required for the normal growth, because our body needs to grow. So, for the normal growth of the body, normal amount of secretion of growth hormone is needed. If the secretion of growth hormone during the growth of the body, that means in your childhood and puberty, is not enough, is less than normal, then the person will not grow. The body will not grow. He will get older, he or she, but the body will not grow. And that will lead to dwarfism. Have you heard that? Yes or no? Okay. Dwarfism. So dwarfism is the condition that occurs due to the lack of secretion of growth hormone during the growth of the body. You know, dwarf people. Now, if the growth hormone secretion is more than normal during the growth of the body, then what will happen? The person will grow fast, will get huge compared to other people. And that is called gigantism or giantism. Okay, so that's opposite of dwarfism. Gigantism or giantism. Okay, so giantism or gigantism is the condition where the growth is more than normal, and that occurs due to the increased secretion of growth hormone from the anterior pituitary gland during the growth of the body. Okay? So those two conditions. Now another condition that is related to the growth hormone that can happen. Your growth hormone secretion was normal during the growth of the body, during childhood and puberty. Now at age 40 or 50, if suddenly the growth hormone secretion increases, then what will happen? In that case, your finger bones and facial bones, particularly those two types of bones, the bones of your phalanges or finger bones and the facial bones, will grow not in length but in width. They will get wider, will increase the thickness, and that condition is called acromegaly. That is called, you will find those in the slides, acromegaly. Okay. So acromegaly is the condition that will occur in older people after the puberty. If the secretion increases suddenly, then the facial bones and the finger bones will grow, particularly those two bones will grow, types of bones will grow in weight or thickness will increase, and that is called acromegaly. The easiest way to tell the acromegaly is that when the facial bones grow, the mandible, if it grows, then the lower jaw pushed outwards. That happens. That is called protruded mandible. Protruded mandible. Anyway, so that's the acromegaly. The person has gigantism or giantism. The lifespan of that person is shorter than normal people. Why the lifespan is shorter in giant people or gigantism patients? The reason is, as I have mentioned, that the growth hormone works in all tissues of the body, right? I said it works on all tissues of the body. So it will also work not only skeletal and bones, skeletal muscles or bones, it will work on the heart muscle, work on the liver muscle, kidney muscle, and will cause the enlargement of those organs. And that's problematic, Enlarged heart, if the heart gets bigger, the heart will not perform the functions normally. Okay, so that's the problem. The other organs cannot function normally because the size increases. Okay, for normal function, you need normal size. And also, the gigantism patients, they suffer from multiple complications like diabetes mellitus. Diabetes is very common, almost everybody gets diabetes. Okay. Thyroid stimulating hormone. Its name is telling you what it will do. This anterior pituitary hormone will stimulate the thyroid gland to release more thyroid hormones. So it will stimulate the thyroid gland. Adrenocorticotropic hormone, ACTH, will work on the adrenal glands. Those are located on the kidneys. So its name is telling you adrenocorticotropic hormone. In your adrenal gland, you have two parts. If you cut the adrenal gland, it has two parts. Okay? The outer part is called the cortex, and inner part is called the medulla. Adrenal cortex and adrenal medulla. So adrenocorticotropic hormone, cortico, it will work on the cortex. Okay? So ACTH, adrenocorticotropic hormone, will work in the adrenal, on the adrenal cortex. That's why it is called adrenocorticotropic hormone. Follicle stimulating hormone will work on the gonads. Inside the gonads, we have follicles, and it will work on the gonads. Luteinizing hormone also work on gonads. So both follicle stimulating and luteinizing, they work on the gonads. Prolactin work on the mammary glands, female breast. So prolactin works on female breast and help in the production of milk. So those are the anterior pituitary hormones. Okay? Posterior pituitary hormone, oxytocin, is very important because it helps in labor, delivery, child delivery. It helps in labor or child delivery. How? Oxytocin is a powerful hormone that causes contraction of the uterus. You know that during childbirth or labor, delivery, the uterus contracts in rhythmic way, like this. The uterus contracts like this to expel the fetus to the outside. So the contraction of the uterus is done by the oxytocin. It is a very powerful hormone. Just remember that another function of oxytocin, it also works on female mammary gland, breasts. and help in the ejection of milk. Help in the ejection of milk from the female breast. Okay, so that is another function of oxytocin. So just remember those two functions. Anti-diuretic hormone. It works on the kidneys. It works on what? The kidneys, and will help to preserve the water in the body. So it will not let the water get out from the body. It will prevent the water loss. That means, now you tell me, it will produce more or less urine? Less, because it will prevent the water loss from the body. It will keep the water inside the body. So if ADH is released more, less urine will be produced. Water will stay inside your body. If ADH is blocked, ADH production is blocked, then the person will do what? Produce more urine. And that condition is called diabetes insipidus. If the production of antidiuretic hormone decreases, in that case, the body will not preserve the water, water will get out from the, more urine will be produced, and the person will frequently go to the bathroom and will pee, and that is called diabetes. This is another type of diabetes, okay? Diabetes insipidus. Not the diabetes that is related to sugar or insulin. This is a different type of diabetes where the patient will frequently go to the bathroom, will produce more urine, okay? And not related to the sugar or insulin. It is related to the antidiuretic hormone and works on the kidney. Okay, so those are two posterior pituitary hormones. Here you see the bottom picture is showing a gigantism patient. The right side person, left side person is normal height, and you see the right side person, and he is actually from not far from US. He has passed away, living in just on the other side of the river in Illinois side, but in close to downtown St. Louis. His picture has been used in many textbooks. This is a famous picture. Okay, many textbooks have used this picture. If you go there, you'll see his statue is there. Okay, and the top picture, you see a patient of acromegaly. You see the finger bones and the facial bones got thick, and the face looks bigger, and the fingers are thick. So that's the acromegaly. Regulation of secretion of endocrine hormones. Endocrine hormones are controlled by the negative feedback mechanism. As you already know, that most of the regulations of our body are done by negative feedback mechanism. Because I told you in very first lecture that our body systems try to work more than we need. That's why you need negative control or inhibition from the control systems. So also our endocrine glands want to try to secrete more than we need. That's why most of the time the secretion is controlled by negative feedback mechanism. So for example, your thyroid gland, they have shown the thyroid gland, one example. So your thyroid gland will be stimulated by thyroid stimulating hormone coming from the pituitary gland, anterior pituitary, and will start to release thyroid hormones. then the blood concentration of thyroid hormone will start to increase, right? Because the gland is secreting hormone. So the concentration in the blood will start to go up, increase, and when it will reach to a certain level, then the signal will go to the hypothalamus as well as the pituitary gland. We know that hypothalamus controls the pituitary. So signal will go to the hypothalamus and pituitary. And that is a negative signal. We'll tell them to stop releasing thyroid stimulating hormone. So the release of thyroid stimulating hormone will be stopped and thyroid gland will stop secretion. Okay, so that's why we say negative feedback mechanism, telling the hypothalamus and pituitary not to produce thyroid stimulating hormone and release thyroid stimulating hormone. Okay, so that's the way the endocrine glands are controlled. So I have quickly talked about the functions of all those hormones. So just know that what I have said when I talked about prolactin, I said that it will help in the production of milk in female breast or mammary gland. Okay, so just know that. Oxytocin, I have talked about that. Antidiabetic hormone, I have talked. Diabetes insipidus, I have talked about that. Okay, now we'll talk about few other endocrine glands. Thyroid gland. You know the location. You know the structure of the thyroid gland, two lateral masses connected by an isthmus, right? You know that. Now, inside the thyroid gland, you will find two types of cells, follicular cells and parafollicular cells. Okay. And thyroid gland produces 3 hormones. This is important. If I ask you which hormones are thyroid hormones, 3 hormones. Okay, T3, T4, and calcitonin. T3 is called triiodothyronine. The spelling is wrong there, so let me correct it. T3 is called, T3 means tri, right? Triiodothyronine. Okay, triiodothyronine is T3, and T4 is called thyroxine, or also called tetra means 4, iodothyronine. Okay, so triiodothyronine or T3 and tetraiodothyronine or T4. Remember here, the name is triiodo. That means it has how many iodine atoms? 3. Tetraiodo, it is telling you it has 4 iodine atoms. Okay. And calcitonin is another hormone of the thyroid gland. Now I will just briefly mention the function. T3 and T4, these 2 hormones increases the metabolic activities or increases the metabolism of the body, generalized metabolism everywhere. The metabolic activity of the body will increase by T3 and T4. So they increase the metabolic activity or metabolism. Calcitonin performs different function. Calcitonin decreases the calcium in the blood. So it reduces or decreases the calcium in the blood. So those are the functions, okay, of the thyroid hormones. So if I ask you which 3 hormones are thyroid hormones, you need to know the names, and T3 and T4 increases the metabolic activities, and calcitonin decreases the calcium in the blood, okay. Now, since you know the action of the hormones, hyperthyroidism and hypothyroidism, you know those conditions. Hyper means what? Yeah, activity, more activity, right? Hyper, and hypo is less. So, if hyperthyroidism occurs in someone's body, then the metabolic activity will increase or decrease. Hyper. So the metabolic activity will increase, right? If your thyroid works more, that means what? Hyperthyroidism. It will produce more hormones, release more hormones. So if T3 and T4 is released more, they does what? They cause the metabolism, right? So the metabolic activity will increase. So in hyperthyroidism patient, since the metabolic activity increases, you will see what kind of changes in the body. When the metabolism increases, just think that when you do the exercise, right? When you perform the exercise, your metabolic activity increases. So what kind of changes you will see in the body?
Weight loss, lack of body fat.
Less fat, weight loss, but immediately what you will see? Heart rate?
Heart rate increase.
Increased heart rate, right? Increased heart rate. So muscle tone increases. So main symptoms of hyperthyroidism: increased heart rate. Body temperature will do what? Increase or decrease? Increase, because when you do exercise, metabolism increases, it produces heat. So one is heart rate will be increased, body temperature will be raised or increased, body weight will be lost, so loss of body weight will occur, and the person will be skinny or fatty? Skinny, because metabolism will burn the fats. So the person will become skinny. So those are the signs of hyperthyroidism. If you see the hyperthyroidism patient, those are the signs. Anybody has hyperthyroidism?
I have hypo.
Hypo?
Yeah.
So hypo will do opposite.
Yeah.
Okay? So the person's skin, body surface will be kind of cold, okay? Colder than normal person. The heart rate will be decreased. Metabolic activity will be less, so the fat will try to accumulate in the body, and the person will be more fatty than normal. Those are the signs of hypothyroidism. Okay. Here you see the thyroid gland, two lateral muscles connected by the isthmus. Now, if you see inside the thyroid gland is filled with follicles. So thyroid gland is filled with follicles. What are the follicles? Follicles are finger-like structures. That's the easiest way to explain. Follicles are finger-like structures. Any finger-like structures or follicles are inside the thyroid gland. Now if you make a cross section, if you cut the thyroid, if you cut the follicles, those finger-like structures, you will see. You cut like this, you will see the follicles are like this, right? And these are the follicles, and the follicles are filled with protein. That protein is called collagen. Okay, so just know that the thyroid gland consists of many follicles, and those follicles are filled with a protein. That protein is called collagen. Okay, and when T3 and T4 is formed, T3 has how many iodine atoms? 3. That means 3 iodine binds with the colloid. That colloid molecule has a name. It is called tyrosine. The protein molecules. The name of protein molecules is tyrosine. Okay. So T3 will bind with colloid molecules of tyrosine and will produce T3. That hormone. In case of T4, 4 iodine atoms will bind with tyrosine, that colloid molecules, and will form T4. So that's how the hormones are synthesized or produced. 3 iodine will bind with tyrosine, that colloid will produce T3, and 4 iodine atoms will bind with tyrosine to form T4, tetrahydrothyroid. Okay. Okay. Now, couple of clinical conditions related to the thyroid gland. If hyposecretion occurs, hyposecretion can lead to myxedema and goiter. Just know that myxedema patients, if you see the myxedema patient, the face is moon face, like round face and puffy, very soft. You can tell by looking from outside that the face is very soft and puffy face. Okay, because it's edema, right? Edema is the accumulation of fluid. So in the tissue, facial tissue, fluid accumulates and make the face puffy. That's the sign of symptom of myxedema. Another condition is called goiter. Goiter is the enlargement of the thyroid gland. So goiter is the enlargement of the thyroid gland. You can see from outside large thyroid gland here. You can see the enlarged thyroid gland from outside. You see that patient, the top picture, the thyroid gland has been enlarged in that patient. It happens in children of third world countries mostly, where the kids don't get enough iodine-rich food. You know that iodine is essential for the production of T3 and T4, right? To produce T3, you need iodine. To produce T4, you need iodine. So if in your food you don't have enough iodine molecules, then what will happen? Your thyroid gland will not produce T3 and T4. In that case, what will happen is, see, you already know now, we know that the colloid binds with the iodine. Now, if you don't have iodine, the colloids will not bind and will not produce the hormone. The colloid will start to accumulate here more and more, and will make the follicles bigger because colloid is not being used, right, to produce T3 and T4. So colloid will start to be stored in the follicles, and the follicles will get bigger and bigger. And when all the follicles will get big, the whole thyroid gland will get big. And that's the reason, due to lack of iodine, the goiter or enlargement of the thyroid gland occurs. Hypersecretion causes a clinical condition that is called Graves' disease. Just know that in Graves' disease, what happens, the main symptom is the patient's eye. If you see, the eyeballs are pushed outwards. So the eyeballs are pushed outwards. So you see the lower picture, a patient of Graves' disease. Why that happens? In Graves' disease, the fat accumulates in certain areas. More fat accumulates in certain areas of the body. One area is in the orbital fossa. You know the orbital fossa? This is the orbital fossa, you know that. So in the back of the orbital fossa, fat starts to accumulate. So that will push the eyeball forward. That will push the eyeball forward. Okay. So that's the reason of the symptom that you see the eyeballs like coming out from the orbital fossa. Okay, so just know that. Calcitonin decreases the blood level of calcium. You remember the function of osteoclasts, one type of bone cells. Those are the destroyers, right? They destroy the matrix of the bone. And matrix of the bone contains a lot of calcium. So calcitonin does what? Inhibits the osteoclasts. Will tell the osteoclasts not to work. So if calcitonin tells the osteoclasts not to work, then osteoclasts will remain silent. They will not break the matrix of the bone. So the calcium will not come out from the bone and blood level of calcium will not go up. So that's how calcitonin decreases or keep the blood level of calcium low. Okay. So just to know that is the main way how calcitonin decreases the calcium. It inhibits the osteoclasts. So osteoclasts will not break the matrix and calcium will not come out from the matrix. We know that calcium is heavily present in the matrix of the bone. Parathyroid glands are attached to the back of the thyroid lobes, 4 to 8 in number, and produce one very important hormone that is called parathyroid hormone or parathormone, PTH. And parathyroid hormone does just opposite of calcitonin. Parathyroid hormone increases the calcium in the blood. So parathyroid hormone increases the calcium in the blood. So it will stimulate the osteoclasts or inhibit the osteoclasts? Stimulate. We will tell the osteoclasts to work more and destroy the matrix more. So the calcium will come out from the bone and will enter into the blood and blood level of calcium will go up. Okay? That is the main way how the parathyroid hormone works. Parathyroid hormone also works on the kidneys and your intestine. So first it works on the bones and activate the osteoclast, that is number one. Number two, works on the kidneys and tell the kidneys not to excrete calcium from the body with the urine. So we tell the kidneys not to excrete calcium out from the body. So the calcium will be preserved, will not get out from the body as with urine. So the calcium level will go up. That's on the kidney. Okay, very simple. It will tell the kidneys not to excrete the calcium from the body. On the intestine, parathyroid hormone will increase the absorption of calcium from the food we eat. So when we eat the food contains calcium, and parathyroid hormone will work on the intestine and will absorb more calcium into the blood. That means we take the calcium more into the blood from the food. so the blood level of calcium will go up. See, all three actions are to increase the blood level of calcium, right? We will stimulate the osteoclast, we will absorb more calcium from the food, we will tell the kidneys not to excrete the calcium from the body to the outside. So all three actions are to increase the calcium in the blood. That's how the parathyroid hormone or PTH increases the calcium. Okay? So just know it works on those three organs and what they do. Okay? So that's the parathyroid hormone. Okay. Adrenal gland. Adrenal glands are located on the kidneys and they are called suprarenal glands. Okay, if I ask you another name of adrenal gland is what? Or which gland is called the suprarenal gland? That's the adrenal gland. Now, so how many adrenal glands you have? 2. And I have shown you before. If you cut the adrenal gland, you see the outer part and inner part. Inner part is called the medulla and outer part is called the cortex. Okay? Now, the cortex, adrenal cortex has 3 layers. You need to know the name of those 3 layers. Okay, I may ask. So, adrenal cortex or outer part of the adrenal gland has 3 layers. Zona glomerulosa, zona fasciculata, and zona reticularis. So those are 3 layers. If you go from outside to inside, I will probably not ask which one is the outermost, which one is the innermost. Just know the name of those 3: zona glomerulosa, zona fasciculata, and zona reticularis. And zona glomerulosa produce mineralocorticoids. Those are the hormones, mineralocorticoids. Zona fasciculata produces glucocorticoids, and zona reticularis produce sex hormones. Okay, so mineralocorticoids, from its name, from their names, you can tell the function. Mineralocorticoids regulate the minerals in the blood. Minerals are, you know, that irons, magnesium, calcium, those are the minerals. And mineralocorticoids control the minerals. Just know that. And comes from zona glomerulosa. Glucocorticoids come from fasciculata. And glucocorticoids, you already know glucocorticoids. Glucocorticoids are cortisone, hydrocortisone. Have you heard hydrocortisone? Anybody? Hydrocortisone. If you buy the ointment, you know, for your eye infection or any infection, if you put that ointment, it very fast heals the injury or inflammation. Strongly anti-inflammatory, strong anti-inflammatory function that glucocorticoids have. Cortisone, hydrocortisone, those are, we use the artificial ones, of course, but they have strong anti-inflammatory actions. You will see 0.1% hydrocortisone or 0.2% hydrocortisone. Very low concentration but has very strong anti-inflammatory action. Okay. So just know that glucocorticoids come from fasciculata and they have strong anti-inflammatory action. Sex hormones come from reticularis, and sex hormones, you know that in case of male testosterone, in female estrogen, progesterone, and they do their actions. Sex hormones do what? Sex hormone performs few functions. One is controls the sex drive, desire. Number 2, help in the growth of the reproductive organs in the body. And help in the secondary sex characteristics. So 3 things sex hormones do. One is the sex drive and desire. Number 2, growth of the reproductive organs. And number 3, secondary sex characteristics. What are those? Secondary sex characteristics are the characteristics those separate males from females, boys from girls. Externally, how you can separate? If I ask you how you separate a male and a female, just mention one. Externally, by looking from outside.
Just by looking, one in the belt breast.
Yes, so mammary glands are best, right? Another one? Tell me something. Say loud. Adam's apple, laryngeal prominence, right? Is present in male. Anything else?
Facial hair.
Facial hair, very good. Those are secondary sex characteristics in male. Broader shoulder, right? And more masculine body. Skeletal muscles are more, not always true, right? Some girls are more muscular than the boys. So, but in general we say that. So, masculine body. Anything else? Voice. How about voice? Voice is different, right? Male and female. So, male voice is what?
A lower pitch.
Low pitch, loud. But female voice is high pitch. You can hear from far. Although, less loud, but high pitch, high frequency. Okay, so those are the secondary sex characteristics given by the sex hormones. Okay, so that's the adrenal cortex. Adrenal medulla, the inner part, produces 2 hormones, epinephrine and norepinephrine. Just know the name of the hormones, okay? So adrenal medulla produces epinephrine and norepinephrine. Epinephrine has another name, you already probably know, adrenaline. Adrenaline is epinephrine and norepinephrine is also called noradrenaline. So adrenaline is the epinephrine, noradrenaline is the norepinephrine. Okay, so those 2 are produced by the adrenal medulla. If the hypersecretion occurs, hypersecretion of adrenal gland can lead to a condition that is called Cushing's syndrome. Cushing syndrome is interesting. If you see the Cushing syndrome patient, few things are noticed. One is called moon face. The face is round. Okay, moon face. That is number 1. Number 2, buffalo hump. The shoulder, in shoulder area, a lot of fat accumulates. So the shoulder looks like, the shoulder of what is that, buffalo, right? The buffalo, bison, yeah, the shoulder is very, bumpy. So like that. So that's the buffalo hump. You see the patient before and after the onset of Cushing syndrome. After the Cushing syndrome, you see the lady got a lot of fat in the back of the shoulder and back of the lower part of the neck. That's the buffalo hump. And so moon face, buffalo hump, and acne. A lot of dark spots are seen in the face as well as in other parts of the body. ACNP, acne. So those are 3 things you will see commonly in Cushing syndrome patients. Okay, since it is a combination of many symptoms. That's why we say syndrome. So remember, sometimes we use the term syndrome, not disease. Why we use the term syndrome? If you see many different types of complications, in those cases we usually say syndrome. So in Cushing syndrome, you'll see different types of complications. Hyposecretion will cause Addison's disease. Just know hyposecretion will cause Addison's disease, and in which the blood pressure and heart rate can drop significantly. The blood pressure will become very low, the heart rate will become very low. Those are the main symptoms of Addison's disease. So just remember those two. Cardiovascular system will be more effective. And ovaries produce female sex hormones, estrogen, progesterone, and testes produce male sex hormone, testosterone. And I have mentioned the important function of the sex hormones. So just remember those. Okay. So